when it comes to aplastic anemia, this is a quick audio discussion on aplastic anemia. So aplastic anemia is a lack of blood cells being produced by the bone marrow, and it's actually a reduction in all of the blood cells. So when all of the blood cell lines are reduced, that's known as pancytopenia. Pan meaning all, penia meaning like lack of or reduction. So aplastic anemia means all the cell lines are low, meaning you have low RBCs, low white blood cells, and low platelets. But it's not just that which is typical of aplastic anemia. You also get a hypocellular bone marrow. Aplastic anemia leads to a hypocellular bone marrow. In fact, our immune system starts to target our own stem cells. So we start to actually get lymphocytes targeting our stem cells. So what is known as a reduction in the red blood cell line? That is known as anemia. What is the characteristic finding of anemia? Well, the answer is when you have lower red blood cells, you have less hemoglobin to bind to oxygen, and you have less oxygen distribution across your muscles and your organs. So you start to feel tired more easily. So fatigue is a finding of anemia, a symptom. And breathlessness or lethargy, tiredness, these are all signs of anemia. Dizziness, headache, tiredness, all of these. What is another type of cell line that may be reduced in aplastic anemia? The leukocytes. When we have low leukocytes, what is the characteristic complication of that? The answer is getting recurrent infections. So far, anemia, pallor, dyspnea, fatigue, exhaustion, those were the signs of the low RBCs, the complication. So the consequence of having low neutrophils and white blood cells, that will lead to recurrent infections, such as an aplastic anemia. Next, the final blood cell line I want to talk about is platelets. What happens when you have lower platelets? Well, platelets are responsible for clotting the blood. So when the blood can't make clots as easily, what do you think will happen? The blood will thin, the blood will be runny, the blood will basically be more prone to bleeding and bruising. So another clinical finding in aplastic anemia in these patients is recurrent nosebleeds and easy bruising. Now we've talked about what aplastic anemia is and the clinical features associated with aplastic anemia. Moving on to the causes and the etiology of aplastic anemia. So the causes of aplastic anemia can be divided into which two categories? Can be divided into acquired causes and inherited causes. Inherited causes of aplastic anemia can be Fanconi's anemia and other autoimmune conditions. But acquired causes is where the list is long. Can you name 3 or 4 acquired causes of aplastic anemia? So drugs can induce aplastic anemia, whether that's anti-epileptic medication like phenytoin or anti-inflammatory medication like NSAIDs. Infection can also lead to aplastic anemia, and specifically it's the parvovirus B19 infection, which typically targets children under the age of 4. Paroxysmal nocturnal hemoglobinuria is another acquired cause of aplastic anemia. So, is there any criteria labs-wise that we can refer to when we think about aplastic anemia? Yes, there is. So the hemoglobin has to be less than 10 grams per deciliter. The neutrophils have to be less than 1.5 times 10 to the 9. And the platelets have to be less than 50 times 10 to the 9. So 2 of these 3 criteria would be enough to signify aplastic anemia. What can be the treatment of aplastic anemia? Well, you can have a curative bone marrow kind of transplant or stem cell transplant in patients of younger age. But in patients of older age, you would give a curative, for example, you would give biologic agents and cyclophosphamide, immunological agents. And your maintenance therapy would obviously be with blood transfusions. They have lower RBCs, so supplement that. Give them more blood. Give them more RBCs. Now I want to move on to parvovirus B19 infection. How does parvovirus B19 infection present in children? So you're going to typically have a 3-year-old or a 4-year-old whose parents say he's had a 2 weeks viral illness where they've had acute shortness of breath, coughing, some kind of viral prodromal illness for around 2 weeks, and now they have a slapped cheek rash. A slapped cheek rash is characteristic of parvovirus B19. The patient's cheek, it will be a little child, and their cheeks will be bright red, slapped appearance, okay? That is how it presents. And after this slapped appearance to the cheeks, this bright red cheeks, they also get a blanching rash, papular rash, or is it macular? They get a blanching rash basically on their upper limbs and their torso and then their limbs basically. That is a parvovirus B19 infection in a nutshell. It's in a child with a viral illness and it's followed by a slapped cheek rash appearance on the cheeks as well as a rash, blanching rash on the limbs. Okay, so yeah, and these children can also have recurrent epistaxis and nosebleeds.